Okay, so this week we're doing the ankle and calcaneus views, or the heel views. So for AP, for the mortise joint, for all the views, first of all, we are going to be using 40 SID. We're going to be collimating to the smallest portion that we can, make sure we see all the structures. We're going to use breathing instructions as if to say don't breathe, don't move during each exposure. And then we will be, for digital x-ray, or for the digital method, we're going to use one view per cassette and center everything into the middle of the cassette. So for the AP mortise view, we're going to have the patient's leg extended, so the plantar surface is perpendicular to the image field. So we, to visualize the mortise, we're going to have the patient dorsiflex the ankle or the foot, and then we're going to have them medially rotate the leg 5 to 15 degrees. So we have a parallel line through the malleoli to the film plane. The central ray is going to go perpendicular down through the ankle joint, through the center of the film space between the two malleoli, and we should be able to see the ankle joint, the distal tibia and fibula, as well as the proximal aspect of the talus. And then for the medial oblique, we're going to have the patient's leg extended, dorsiflex the foot still, but we're going to have them rotate it medially. So there is a 45-degree angle forming with the image receptor. So I'd actually have them probably scoot over like that. And then the central ray would still be going perpendicular to the ankle, midway between the two malleoli through the center of the film. So we can see the lateral malleolus, the distal tibia, the ankle joint, and the distal tibiofibular joint. And that would be for the medial oblique. And then the lateral ankle, we need the patient's leg extended and have them roll towards the affected side. So we would have them rotate laterally, like so. And the leg, so the foot and the leg are both in the lateral position, and the central ray would be going perpendicular to the mid-ankle joint. So right about in this area here through the center of the film, and we should be able to see the distal tibia and fibula, the ankle joint, the talus, the calcaneus, and the base of the fifth metatarsal. So we don't really necessarily need the toes in this view. Okay, for the semiaxial calcaneus view, patient is going to extend the leg and dorsiflex the foot so the plantar surface is perpendicular to the film. Where they're going to be placed at the edge of the film space, down at the level of the heel. So the image receptor would actually be over there, and the central ray would be coming through the base of the third. It would actually be coming 40 degrees cephalic to enter the base of the third metatarsal. So if you look at my foot, it would be down here, coming through the center of the film space. And you should be able to see the plantodorsal projection of the calcaneus from the tuberosity to the sustentaculum and trochlear process for that. And that is all for those views.